Welcome to Chapter 21. Here we will be discussing respiratory care modalities, and I do want to inform you that we will only be covering pages 493 to 506 within the basic course. In your advanced course, you will cover the rest of Chapter 21, which goes over more in-depth respiratory care. When looking at oxygen therapy, of course, administration of oxygen at greater than 21%, which is that of room air, to provide adequate transport of oxygen into the blood, to decrease that work of breathing, and to reduce the stress on the heart. You can refer to chart 21-2, which goes over some oxygen therapy. It's a home checklist. Just briefly review it. Of course, the biggest thing you want to know about that is not to smoke while using oxygen. I know that would seem like common sense, but of course, we do have to tell our patients that. And there's a few other things in there you want to look at. One of which is being identifying the signs and symptoms of indicating the need for change in the oxygen therapy. Like if the patient is on 2 liters and it is still hard for them to breathe at home, then that oxygen may need to be increased. We don't want them to increase it, but we do want them to keep a log of some sort, letting them know to tell the provider if they're still having trouble breathing. Also, keeping the tank out of direct sunlight, and of course, when traveling in an automobile, place it on the floor behind the front seat. If they do have to travel via plane, you want to notify that carrier at least 2 weeks in advance because they do have to accommodate that. And when you're traveling frequently, especially with oxygen, they usually have the smaller portable ones that can be concealed in a backpack. So do be aware of that. Sometimes you may not even know that your patient has oxygen unless you see that nasal cannula. So you do want to look at the indications and some complications that can occur, specifically looking at oxygen toxicity. We want to prevent our patients from having that. Also, you want to look at the methods of administration, being that one of the most common methods is your nasal cannula, and then probably your second most popular one is our non-rebreathers. So you do just want to review those two and understand what they are and when they are used. And here is a brief illustration of some of the types of masks that deliver oxygen, with A being your Venturi mask, B being your non-rebreather, which we talked about and I want you to review, and then C is the partial rebreather. So I do want you to understand what the non-rebreather is versus the partial, as well as your nasal cannula, and understand the differences between them. Also, a good source of information is Table 21-1 in your text on page 496, which goes over the oxygen administration devices. As you can see with your nasal cannula, the suggested rate is about 1 to 2, with it going up to about 6. So, with your non-rebreather, the suggested rate is about 12, whereas your partial rebreather goes from 8 to 11. So do know the differences and some of the advantages and disadvantages when looking at the cannula versus those non-rebreathers. Here you see another illustration of a T-piece or a tracheostomy collar, and you'll talk more about that within the advanced course about how your patients that have trachs also need to receive oxygen. If they do need to receive oxygen, this is one of the ways that we can assist them. And here's a true or false question in regards to a patient with COPD and a nasal cannula. And here's the answer with the rationale. Now, Going back a little bit, looking at some of those complications of O2, we do want to know that oxygen toxicity would be one of those that could be a complication. Fire being a big one. That's why we have to educate our patients on not smoking around these things. Okay. And when we look at oxygen toxicity, understand what it is, some of those symptoms that the patient may exhibit, and how we can prevent that. Here you find another true or false statement in regards to a patient with hypoxemia. And here's the answer with the rationale. Now, we will look at incentive spirometry. This is one of the more important things that I want you to pay closer attention to. First, I want you to look at your text. At page 499, you will find chart 21-3, which goes over how to educate your patient when performing incentive spirometry. Of course, you want to teach them how to use it. This is the most important thing, teaching them how to use it. Any indications that is needed for this as well. Also, you can look at chart 21-4, which goes over patient education and breathing exercises, more specifically looking at diaphragmatic breathing. And the goal with this is to use and strengthen the diaphragm during breathing. So this is a helpful technique to prepare for proper use of nebulizers. These types of things are used for your patients that have chronic disorders such as your COPD or chronic obstructive pulmonary disease. And it dispenses inhaled medications, and they are commonly used at home. So we want to educate our patients on that as well. And again, that is found in your chart 21-4, which goes over those breathing exercises. And if you don't understand what the diaphragmatic breathing is necessary for, I do want you to also review what a small volume nebulizer therapy is all about. And then putting the two together, using that diaphragmatic breathing will assist your patient. And here's the answer with the rationale. So we talked a little bit about diaphragmatic breathing, but what I want you to do is look at that mini nebulizer therapy and how diaphragmatic breathing is incorporated with this to assist your patient. When looking at chest physiotherapy, you want to know that it includes postural drainage, chest percussion, vibration, and breathing retaining, along with effective coughing. I do want you guys to pay closer attention to the postural drainage, knowing that there are different positions in which the patient can be positioned so that they can drain. You also want to educate your patients on how to effectively cough. That can be found in one of your charts in your text as far as effective coughing and patient education. You want to make sure they understand that their position, depending on where the secretions are, can affect how drainage occurs. The next few slides will review postural drainage and the positions in which the patients are in in order to elicit that drainage for particular lobes in the lungs. In this position, both upper lobes are going to drain, and the pillows are in a different position, and the patient is more on their back with their lower pelvic area heightened. Now the patient is on the opposite side, which will drain both lower lobes of the right and the left. Here the patient is sitting more upright, and it will drain the upper lobes of both right and left. Here the patient is laying on their abdomen with pillows adjusted, and this will drain the lower lobes or the superior segments of the lower lobe. And in this figure, the upper lobes are again going to drain in the superior segment. And note how the patient is positioned with the pillows. Here is an illustration of the postural drainage percussion vibration. And this can also be found in your text on page 502. You do also want to look at chart 21-5, which goes over patient education for effective coughing techniques. When looking at patient teaching, of course, you want to teach them about oxygen safety, especially in the home. Again, you will be able to refer to that chart in your text that goes over some of those safety features, especially when having to travel, not smoking, precautions when using the oxygen, notify the fire department that oxygen is being used. You want to post no smoking signs in the house so that others do not smoke. You want to make sure they know the flow rate and how to adjust their tanks. You want to look at the maintenance of the equipment and let them know how to tell when the oxygen is low. Also, you want to educate them on diet, activity, and travel, as well as electrical outlets, and making sure that everything is in working order. And then lastly, we'll look at briefly endotracheal intubation. You will go more in depth with this when you go into advanced, but what I do want to let you know about this is that, first of all, it is not in your scope of practice to be intubating your patient, but you want to know what it is and how it assists your patient, of course, and you want to know that it provides that patent airway. We always want to keep a patent airway for our patient. So you want to know what it is and what it does. You don't have to know the technical or the technicalities of it, but I do want you to understand what the endotracheal intubation is. You will go over in-depth care and managing that system when you get to advanced, but I do want you to look at page 506 in your text when it talks about complications. And most of these can occur from the pressure exerted by the cuff on the tracheal wall. So note that it should be maintained between 15 and 20 millimeters of mercury, and that endotracheal tubes that are there for longer than 20 days, they usually want to recommend a tracheostomy at that point, because after that 21st day, it can irritate that tracheal lining, so it can break it down, and then we're at risk for losing that airway again. So Not only are we at risk for losing that airway, we're at risk for nerve damage, amongst other things. So they would look at doing a tracheostomy. And lastly, here is an illustration of a simple endotracheal tube in place. And of course, it has been done by the oral route. And the cuff that they are talking about is placed in the patient's throat. If you see the little, it looks like a gumdrop near the end of the tube. That is the cuff that we are referring to, saying that it needs to be no more than 15 to 20 millimeters of mercury. Because, of course, if that cuff is too high, it can cause tracheal bleeding, pressure necrosis, or even ischemia. So we don't want any of that to happen. We want to maintain that airway. So we're trying to keep all of those from happening. And with that, that will conclude chapter 21 for basic, going over the respiratory care modalities. Again, you will cover the rest of that chapter in advanced adult health.